really thrilled to have you here today. So Dr. Mark Escott he did his training originally as an undergrad at Rice, and then he got his medical degree in Australia with a specialty in emergency medicine. He has a master's in public health. He's on the faculty at Del Med, but he's directed a lot of medical programs for universities and communities across Texas and across the world, in fact. But most importantly, he is in Austin, Texas, our medical director and health authority who is leading the COVID response efforts for our community. And much of our work in the consortium, the modeling work that we have done for Austin, including our Austin dashboard, is directly inspired by Dr. Escott's efforts at the front line, keeping us all safe and healthy. And I asked Dr. Escott here today to give us an update on what's going on and really just anything that he wants to share that could help guide our efforts so that we can continue to do modeling to support situational awareness and response efforts in the weeks and the months ahead. So Dr. Escott, I'll hand it over to you. Feel free to take this where you want, and we'll ask questions if time permits. And also we'll let you run at 9:45. So thanks.
Yeah, I'd rather stay with you all because I'm really tired of talking to the media, but duty calls. So first of all, Lauren, thank you for the incredible work that you and the team have been doing for us. I tell you, I think we've just been blessed to have this collaborative relationship with so many different stakeholders, but in particular, you all on the academic side. And I hope that this partnership, this collaboration will continue well past COVID-19, because I think it is something that we certainly value and will value in the future. So thank you for all of y'all's work. I do have a question though before I get started, because it's come up today. What are y'all using for the average length of stay for hospitalization and ICUs in the model right now?
I will have to defer that to somebody who has the parameters in front of them. How about we tell you that by 9:45? Look it up.
That sounds great. We've got a little battle with FEMA, who is questioning whether or not they should fund our protective lodges.
Okay.
So that would be helpful. Lauren, I'm going to share my screen, and I'm going to try to share my screen and show y'all a few updated slides if I can find the right screen here. Can you see my PowerPoint?
We can, yes.
Okay, perfect. I'm not going to put it in presentation mode because it's going to screw up my computer. But basically, this is where we are right now in terms of our confirmed cases. I talked yesterday at Commissioner's Court about this plateau we've seen for about a week in terms of our new cases. Our hospital admissions have plateaued for about 10 days now, 11 days. Yesterday we had a positive glimmer of a trailing line in the downward direction at 14 admissions. So maybe we'll break that second plateau that we're seeing. And then obviously similar effect on total hospital beds being utilized. I do want to skip down to this slide to just talk a little bit about our positivity rates and the fact that we are looking a bit more closely at these now, in addition to the hospital admissions. And this is, for two reasons. Number one, because the data is coming to us in a more timely fashion, thanks to the great work from Dr. Pignone to get our testing entities together and feeding us data regularly. But this is, the other reason is because it looks like it's, significantly preceding the impact on hospitalizations, and I'll show a slide on that in a second. But basically, we've seen this steady decline. We had a 2-week plateau here at week 33 and week 34. Week 35 is 4.6%. Week 36, which doesn't show up here yet, but the current data, we've got about 8,000 tests resulted right now, it's about 4.5%. So we have this 2-week plateau at about 6%, and this 2-week plateau at 4.5%. Broken down by race and ethnicity, obviously there's substantial variations based on race and ethnicity. But again, our most challenging group, our Latinx community in this gray line, we've seen a progressive decrease to under 10% in week 36. And then when we overlay these things together, this is sort of what it looks like. So we've got the new cases per 100,000, which is actually the 7-day moving average of the new cases per 100,000 in the blue. The orange is the 7-day moving average of new admissions, and the gray dots are that same positivity data that you see. So we can see back here on, in the early June, we started to see an increase in that positivity, which resulted in increased hospitalizations about a week later. Similarly, we see a plateau happening around June 17th to July 1st, which corresponds to this plateau that we see here, and then a drop-off corresponding to the drop-off that we see in the hospital admissions. Interestingly enough, we have this plateau that that we just talked about, that 6.1% positivity, and this plateau. So it'll be interesting to see if we see another step off in the next couple of weeks in terms of new hospitalizations. Again, this is relatively new information, but it's something that we're certainly paying closer attention to than we had in the past, because we have the data and because there, at least loosely, seems to be some correlation between changes in that positivity rate and changes in the other indicators. I put this arrow here because it seems that the debate on masks is coming around again, at least to my Twitter accounts, where folks are saying that masking doesn't work. But clearly there's at least an association between when the governor issued the mask mandate and when things plateaued and then fell sharply. So these are a number of things we're looking at. Obviously, we are trying to look forward into the fall in particular, and planning on when we might expect that next surge to happen, so that we can appropriately plan. Obviously, it's substantially more complicated now with both flu season happening and with schools and universities in session. So the policy implications, which will be much more impactful if we have to close things down again. We can certainly expect a lot more resistance to closing things down again once they're open.